Hello everyone, my name is Dr. Parissis and welcome to another video. Today I want to talk about why you should probably get an FUT hair transplant over an FUE hair transplant. Now there's two main ways of doing a hair transplant, FUE and FUT. FUE, follicular unit extraction, is where we take individual grafts from the safe donor area, which is this region here at the back of the head, where there's hair follicles that are safe from being lost. In other words, they're permanent. We take them from the back and sides and we put them wherever we like, and they'll ideally last a lifetime. FUT, otherwise known as strip surgery, is when surgeons take a strip of the scalp, they take the hair follicles and the skin as well with it. They individually pluck out the follicles from that strip under a microscope, and then they place those grafts at the top of the scalp. Actually, in history, FUT was the first technique of hair transplant surgery. But the issue with hair transplant surgery at the time was that the results weren't good enough. And that was really an issue more so with the implantation process rather than the harvesting process. Unfortunately, the poor results that were received by patients at the time was kind of associated with FUT hair transplant surgery. What I want to stress is that there was an issue with the implantation process because doctors were implanting hair grafts that were damaged, and they were also implanting big blocky grafts at the front of the hairline. Doubles, triples, what we call multis. And this meant that patients were getting unnatural results, unfortunately. People were also quite concerned about the linear scar that comes from FUT, and that's why in recent years FUE has been booming. FUE is the main technique done by almost all the clinics in Turkey, where most hair transplant surgeries are actually performed in the world right now. And actually FUE is what has contributed to making hair transplant surgery more mainstream and more open to the public. But unfortunately FUE does not replace FUT. FUT still remains to be the gold standard hair transplant technique. Just like in other forms of surgery, for example, appendix surgery, if you have appendicitis and you need your appendix removed, in some cases the surgeon might be able to do it via keyhole surgery, in which case small incisions are made and a camera is put in order to remove the appendix. But in some scenarios, the surgeon might have to perform open surgery. And the fact that both of those techniques exist means that each technique is more appropriate for certain scenarios over the other technique. And it's exactly the same with FUT and FUE. I think because of the lack of linear scars, FUE surgery has been seen to just be the only form of hair transplant surgery you need to know about. But it's not the case, and FUT is actually probably more appropriate for most patients. Number one, the total number of grafts that you get over a lifetime is better when you incorporate FUT as well as FUE. I've actually done a research paper with Dr. Bloxham, which mathematically proved that you get more grafts over a lifetime, significantly more grafts actually over a lifetime with by starting with FUT and then doing FUE later down the line. And this is not just a small increase. Really, you can almost double the number of grafts that you get if you incorporate FUT from the beginning. And this is most important for patients who have advanced hair loss. That's young people who have lost already a considerable amount of hair. It's older patients who have lost a lot of hair. These patients come under the category of advanced hair loss patients. And if they are worried about being bald and they want full hair restoration throughout their whole life, then FUT is really important for those patients. In addition, FUT harvests all of what we call the safest grafts. Now, obviously the safe donor area is this large region here, and that's what people mostly think of it as, but actually there is a strip within the safe donor area, in the middle of the safe donor area, that is actually most safe. So in almost 100% of men, this strip, this area of hair will never be lost. And that's why using FUT takes all of those grafts and guarantees that you make the most of your safe donor area as a result. The duration of an FUT operation is much shorter, and this benefits obviously practically means that the patient isn't under as much stress, and also the doctor doesn't get as tired, but also it means that the grafts are outside the body for a shorter period of time. And just like any organ, if you remove it from its blood supply, eventually it will be starved of oxygen, and the longer you leave it of its blood supply, the more likely it is to die. And so FUT, the grafts are only kept outside the body for a maximum of about 6 hours, whereas with FUE, this is much longer since the extraction process takes a lot longer. And the final point is just to get rid of some of the scaremongering associated with FUT scars. They really aren't as bad as you would think. I personally have had FUT. I'm very, very happy with it. You can get a haircut as low as a 3 before it being seen. 90% of our scars are about 2 millimeters in width, and this is an example of that. Now, of the 10% remaining, 5% will be actually less than 2 millimeters. And a scar that is less than 2 millimeters is virtually undetectable by the human eye. If you're one of these lucky people, you can really get a haircut even lower than a 3 and it likely won't be seen. As with every surgery, there are a select few patients that undergo FUE that will have large scars as well. And it's the same in FUT. The other 5% will be larger than 2 millimeters. And so it really depends on how you scar as a patient. If you are a wide scarer, meaning that when there is a wound, lots of fibroblasts are placed into that wound. If you're naturally a wide scarer, you'll have loads of fibroblasts being placed down and more fibrotic tissue in a wider scar. If you're someone who's a wide scarer, then this will be the case if you undergo FUT or FUE. And FUE is no exception to scars. Actually, in terms of surface area, FUE actually causes a greater surface area of scarring compared to FUT. I am someone who I'm passionate about hair loss and hair restoration, and I think that everyone deserves to know the truth. Good clinics should utilize both techniques. I think that FUT still has undeniable benefits over FUE, and I think that the scar from FUT is, on the whole, nowhere near as bad as a lot of people might think. Thank you so much for listening. If you're new to this channel, I post regular videos about updated hair loss treatments and a lot of information about hair transplant surgery. I'm also a hair transplant surgeon myself, and if you're interested in a consultation where we can discuss your hair loss journey, your genetics, your family history, how likely you are to undergo further hair loss, or whether you'd be a candidate for hair transplant surgery, reach out to me at drparissis@gmail.com. I know I've got a lot of you guys coming to me at the moment, so I'm really thankful of that. I look forward to talking to some of you soon.